Good morning, class. This is Group 3. I'll be presenting Scenario 3 in Communications in Nursing. The group members are Renuka Mananchan, Shanice Marcel, Bina Matura, Mandesa Maureen, Laverne Ned, and myself, Jade Nicholas. Objectives of this lecture. At the end of this presentation, students will be able to 1. Describe communication in nursing. 2. See the aspects of communication in nursing. 3. Define therapeutic communication. 4. Name the types of therapeutic communication. 5. Outline why therapeutic communication may be needed in this scenario. And number 6, state which type of therapeutic communication is best suited to be used in this scenario and why. This scenario states that 2 student nurses are allocated to an outpatient clinic. During an assessment of a patient, the patient starts crying and screaming loudly. One of the students tried to console the patient by asking what was wrong. The patient just continued crying. We are to outline the communication skills and what the appropriate action is needed in this situation.
Communication in nursing. Good communication between nurses and patients is essential for the successful outcome of individualized nursing care for each patient. To achieve this, however, nurses must understand and help their patients by demonstrating courtesy, kindness, and sincerity. Also, they should devote time to their patients to communicate with the necessary confidentiality. They must not forget that this communication includes persons who surround the sick person, which is why the language of communication should be understood by all those involved in it. Good communication is not only based on the physical abilities of nurses, but also on education and experience. In practice, its practice requires not only scientific knowledge, but also relational, intellectual, and technical skills and competences. This means combining knowledge, clinical work, and interpersonal communication skills. Communication is an essential element of nursing in all areas of activity and in all interventions such as prevention, care, therapy, rehabilitation, education, and health promotion. Furthermore, the nursing process is a scientific method of nursing practice and implementation. Communication is the exchange of information, thoughts, and feelings between people through language or other means. The therapeutic practice involves oral communication between public health officials and nurses on one hand, and the patient or family members on the other. Effective communication requires an understanding of the patient and his or her experiences. It requires skills and simultaneously the sincere intention of the nurse to understand what concerns the patient.
Aspects of communication in nursing. The aspect of communication in nursing is verbal. Verbal communication is where words are spoken by mouth. Also, listening is part of communication. Listening is not just understand spoken or written, but also understand how the person is feeling. The quality a nurse should possess is making a patient feel comfortable, accepting, responsive, and emphasis. Comfortable listening to the patient and using language that is meaningful to them. Acceptance. Simply making eye contact and saying, I understand. Response. Listening to their concern and respond back to them. Emphasis. Be aware of the body language.
Therapeutic communication occurs when a patient needs are met rather than the needs of the nurse. The input from both participants contribute to healing, growth, and the promotion or prevention of illness. In this alliance, it takes time, requires skills. It focuses on the client, and an early understanding in this relationship can establish that the nurse is safe, consistent, and confidential. The nurse uses communication skills such as providing support, information, understanding, and acknowledging the strength of the patient while maintaining a level of professional distance and objectivity. These techniques prioritize the physical, mental, and emotional well-being of patients. Therapeutic communication can also be defined as an exchange between a patient and the provider using verbal and non-verbal communication. I now pass you on to my colleague, Shanice.
Thank you very much. So the type of therapeutic communication, there are two main types, which is verbal and non-verbal communication. So what is verbal communication? It encompasses the art of using both spoken and written language as a powerful medium for sharing messages, information, and emotions with others. When engaging with patients, it involves the skill, use of speech and spoken words to convey crucial information, express empathy, deliver key messages, and encourage open and meaningful dialogue. The power of verbal communication lies in our ability to utilize words, tone of voice, and active listening to connect with patients and provide effective care. So some of the examples of the verbal therapeutic techniques involves the vocabulary, which is the use of words that are easy to understand and considerate of the patient's perspective, denotative and connotative meaning, beware of what words imply and their emotion impact to avoid misunderstanding. Pacing, this is the how we speak at a pace that suits the situation, whether we slow it down for patience or speed it up for clarity. Annotation, this is the way that you say things matters. Your tone must match the message, showing empathy and sincerity. So we have clarity and brevity. This is the use of straightforward language to prevent confusion and to avoid jargon and be concise. And we have timing and relevance. Know when to say and what to say. Timing is everything for respecting the patient's need and urgency. We now go on to nonverbal communication. Nonverbal communication is effective means by which we express our emotions, needs, intentions, attitudes, and thoughts without relying on words. These unspoken cues are a powerful way to show empathy, understanding, and support in therapeutic interactions. Here are some crucial nonverbal therapeutic techniques for effectively managing nonverbal communication. So we have the personal appearance. This is the way you present yourself to patients, and it may impact how they see you and establish a tone for trust and professionalism. We have the posture, the way you walk and carry about yourself may convey confidence, attention, and approachability. We have facial expression, whether warm and empathetic or attentive and worried. Communicate, your emotional engagements. So we have establishing good eye contact, express honesty and regard for the present and feeling of the patient. Gestures. This is thoughtful. Gestures may improve the communication by emphasizing and clarifying your words. So we have songs. This is sights, laughs, and soothing vocalization are examples of nonverbal noises that can indicate empathy and understanding. And then we have territoriality and personal space. This is respecting personal space and being mindful of patient comfort zone are crucial for establishing trust and maintaining a sense of safety. So I'll now invite Laverne to continue the presentation.
In this scenario, the nurse should demonstrate empathy as a form of therapeutic communication towards the patient in acknowledgement and appreciation of the patient's emotions. Therapeutic communication will assist with assessing the needs of the patient. It will also provide support by making the patient comfortable enough to cease the screaming or crying and reassuring them that things can work out. Therapeutic communication would also allow the patient to vent or talk completely, as they may need to clear things off their chest, and this will also assist the nurse to know what help is needed and guide accordingly. It also allows the nurse to demonstrate active listening skills, which includes eye contact, nodding, short verbal responses, and in this method, we would also reiterate that it is very confidential and that a solution could be met.
Which type of therapeutic communication is best suited to be used in this scenario and why? As stated by my colleague earlier, therapeutic communication is used when the patient's needs are to be met rather than the nurse's. In this specific scenario, 2 student nurses are working at an outpatient clinic. When during an assessment, a patient started to cry and scream loudly. One of the student nurses tried to ask the patient what is wrong, but she doesn't answer. Instead, she continues crying. Our group has decided that the most appropriate type of communication needed for this scenario is therapeutic communication, specifically non-verbal therapeutic communication. Non-verbal communication is the best type of communication to be used here, as the patient was unresponsive when the first nurse tried asking her what was wrong. And by using non-verbal communication, we are able to let the patient know we are there for them when they are ready to communicate. When a patient is non-responsive, non-verbal therapeutic communication becomes critical. It involves using gestures, facial expressions, touch, and body language to convey care, support, and understanding. This form of communication can help create a connection with the patient and provides comfort, even when verbal communication is not possible. Conclusion. In conclusion, therapeutic communication is an important aspect of healthcare. It involves using active listening, empathy, and open-ended questions to build trust and support patients' emotional well-being. It can help improve patient outcome and promote a positive therapeutic communication between healthcare providers and patients. Thank you for coming to the end of our presentation. These are the references that we use to deliver this information. Thank you.